Assalamu alaikum, peace be upon you. I am Dr. Alaauldeen AL-Sallami from Science Faculty, University of Kufa from Iraq. I wanted to participate with you in February 24 conference, but it was postponed to 27 from this month in the third International Conference on Research and Life Science, and therefore the idea of the current research started from the Holy Quran. Bismillah ar-Rahman ar-Rahim. Lillahi mulku as-samawati wal-ard yakhluqu ma yasha yahabu liman yasha inathan wa yahabu liman yasha ad-dhukur أو يزوجهم ذكرانا وأناثا ويجعل من يشاء عقيما إنه عليم. The title is Effect of Antiphospholipid, IgG and IgM, and it is relationship with the level white blood cells in the woman undergoing intracytoplasmic sperm injection, ICSI. Infertility is a widespread disease worldwide, and its mean the inability of spouses to achieve pregnancy within the 1 year of marriage, and the estimated rate of infertility in the world is around 15 to 20%. About 40% are due to the wife, and about 40% other are due to the husband, while the couple together contribute to 10% of cases of infertility. There are many techniques for treating infertility. One of them is in vitro fertilization, IVF, is one of the most common methods used to treat infertility, and this is done by injection sperm into the oocyte to get the fertilized oocyte. In vitro fertilization, oocyte placed in the culture media several days before being transferred to the uterus of the patient. There are many problems with these techniques and the occurrence of miscarriage, and found several various studies in recent years have indicated that occur risk factor for implantation failure of women after intracytoplasmic injection or ICSI, which may be immunological parameter or biochemical parameter may be affected on this ICSI. Current study aims to determination of the certain immunological parameters change their relationship in each of the three groups: implantation failure, spontaneous miscarriage, and continuous pregnant as control group. Therefore, the objective of the study were: 1. A study effect of some immune factor, white blood cells count, antiphospholipid, IgG and IgGM, that lead to implantation failure or spontaneous miscarriage after using intracytoplasmic sperm injection. And 2. Study the female pregnancy success rate after using ICSI technique and study relation between the factors involved in this study. The result show of the current study showed a significant increase in the level of the beta human chorionic HPCG hormone, and there is reason or the increase in the level of this hormone is evidence of high success rate of pregnancy for women undergoing ICSI, where the success rate initially reached 61%, 9% after which increased to 33.3% after first 3 months due to occurrence of these studies, spontaneous miscarriage of for women. The results of the current research also showed a significant difference in the probability of 0.5 between showed between the groups an implantation failure and spontaneous miscarriage combined with the control group continuous pregnancy. Also, the research showed the significant increase in antiphospholipid antibody level IgG and antiphospholipid IgG-IgM in the implantation failure group and spontaneous miscarriage. The important results were a positive correlation between white blood cells and antiphospholipid IgG and white blood cells and phospholipid IgM. This correlation, that indicator for many clotting or many infection become in the placenta, because clogged blood vessels in the placenta, this placenta that are responsible for delivery food and oxygen for mother or fetus or during pregnancy. The conclusion from this study: intracytoplasmic sperm injection technique has a great role to overcome the problem of the low fertility. And the second, the antiphospholipid IgG and IgM is positive correlation success with in the intracytoplasmic sperm injection ICSI, because it's evidence thrombin the capillaries and lead to lack of the blood flow to the uterus. And 3, this white blood cells high level has had a negative effect on the pregnancy of women that after intracytoplasmic injection technique. Recommendation from this study: performing in the analysis to measure the level of antiphospholipid IgG and antiphospholipid IgGM before and after intracytoplasmic sperm injection ICSI to detect thrombosis in the uterine blood vessels, which may be lead to an increased rate of failure or spontaneous miscarriage of pregnancy. This research was part of PhD thesis study of several criteria affecting the occurrence of the miscarriage or implantation failure in the woman undergoing ICSI or intracytoplasmic sperm injection. This study occurred in the 2020. I have published a research paper from this thesis, and I also hope that we will publish it in your support scientific journal with Healthcare and Biological Science Research Association. Thank you for your listening, and please accept my apology for not continuing the dialogue with you and discussing any question, because I am busy in the month of March with another conference. And anyone, would you like to connect me via the official email of my work please, of Faculty of Science, University of Kufa, in the email AL-Sallami @Kufa Education, Iraq.